I am the pre-kidney transplant coordinator for University Medical Center. Our partnership with UT Southwestern has been remarkable. And the kidney transplant resources that are available to the patients in West Texas and Eastern New Mexico area gives them opportunities to get the care that they need close to home.
People are coming from a 300-mile radius that really have thrived after transplant.
I started dialysis last February. When I found out that UT Southwestern had this clinic here in Lubbock, I was really hoping this would work out.
When we first met Miss Carson, she was 78 years old. She had been denied by other programs because of her age, and I informed her that there was no age cutoff for UT Southwestern.
I had just begun my freshman semester here at Texas Tech. I was 18. I was diagnosed with end-stage renal disease. I was put on dialysis, and I came across UMC, who was partnered with UT Southwestern, and it was meant to be.
My first transplant actually was when I was 15 years old. It lasted me 20 years, and unfortunately, I finally rejected my body, and now I'm back at it at round 2.
If you're interested in being waitlisted or being part of the UT Southwestern family, you get seen in our clinic, but the clinic is actually here in Lubbock. They have a coordinator for before transplant and the waitlist process, and a coordinator after transplant. And with partnership with UMC, a lot of the testing and the workup can be done locally for the patient.
They're able to come in, see me, do their tests, do their lab work, and see our social worker, see our nephrologist from Dallas, all in one day.
We need to make sure that people have good support before, during, and after transplant. So I really work closely with the patients and their families. I just really like sharing their journey with them.
If you need to be seen, we will see you at UMC. And then really what you're doing is you're waiting for that phone call. The one reason to come to Dallas is for your transplant.
I got the call from the clinic saying, "You got a kidney." And as soon as I heard that, I went home, picked up my bag, and took off to Dallas.
When I was taking my final exam, I got the phone call that morning, and it was time for me to go get a transplant.
It seems like every single person we met at the hospital, they were happy to be there. They loved working there. And my family, they continue to tell everybody who will listen to them how great UT Southwestern is.
It is such a big thing to get a new kidney, and patients want to make sure that they're doing it right. We'll help make sure patients really truly understand from a post side what needs they have and make sure that those needs are being met for them. Once patients do get further out from their transplant, we do also do telehealth appointments.
We live probably 10 minutes away from the clinic. To be able to come back here and do all of the appointments and the labs, we could still have that quality of care and just be so close.
When you go to West Texas, everyone is just so nice. And I think it is nice to see that we're welcome into their community.
My favorite part is when they come back to me and they're transplanted, how happy they are to have their life back.
I'm now living my life as a 24-year-old. I'm traveling, I'm getting my education, I do study abroad, and that's something I can never do on dialysis. It's a second chance at life.
My plans for the future is to stay healthy and just live life and just enjoy it. I've been blessed.
I feel so good. I feel like I can live again. I am so thankful for every single day. It's a new life.